En 2009, la Saskatchewan a effectué un sondage auprès de ses citoyens pour savoir ce qui comptait le plus pour eux en matière de soins de santé. Ce sondage, intitulé Patient First, a révélé que les périodes d'attente pour les soins chirurgicaux constituaient un sujet de préoccupation d'une grande importance. La province a donc décidé de faire quelque chose à ce sujet. En 2010, le ministère de la Santé de la Saskatchewan a mis sur pied l'initiative pour les soins chirurgicaux dans le but de réduire les périodes d'attente pour les chirurgies dans toute la province.
Saskatchewan Surgical Initiative is a provincial initiative where we are looking at creating opportunities for the people of Saskatchewan requiring surgery to get timely access, and the overall goal is that nobody should wait longer than 3 months to have their surgery done in Saskatchewan.
I think the situation was quite terrible for patients who were waiting 18 months, 2 years for surgery.
It started out about access, about dealing with what were some of the longest waiting lists in the country, and it certainly morphed and turned into what was most appropriate, which was transforming the surgical experience.
And so we're looking at ways that we can really become more efficient and use our resources in a different way so that we can reduce those wait times and provide better care.
La Saskatchewan a créé de nouveaux éléments et procédés, notamment un système d'aiguillage centralisé qui donne aux patients un accès plus rapide aux spécialistes et un répertoire de spécialistes en ligne qui permet aux patients de voir les périodes d'attente pour consulter certains spécialistes et agir en conséquence.
Pool referrals is instead of a practitioner referring to any particular surgeon, they refer it to a pooling service, and the pooling service has knowledge of our wait lists, and if there is no particular surgeon identified, the pool or the individual patient will get sent to the person with the lowest or the shortest waiting list.
What we've been trying to do is work with patients to understand that they have choices, and again, we would never deny a patient choice if they prefer to have their procedure in a particular location or with a particular specialist.
We had a number of barriers to overcome, but interestingly, we were able to, as a group, collectively decide that pooling our patients was better for our patients, better for ourselves, and better for the referring physicians.
It reduces variation. It reduces if you have 10 surgeons, typically you'll have 3 or 4 of them that are very busy, you'll have 3 or 4 of them that are medium, and 2 or 3 or 4 that are not so busy. And what this does is it tries to level them out.
We actually do the front end work and getting people into a process and a programmer, if you will, a stream in terms of getting them prepared to either have surgery or looking for opportunities for them to perhaps manage some of their challenges pre-surgery.
So it improved in the sense on something that I thought was going to be a little bit longer. Now that doesn't mean to say that it is necessarily ideal. You know, it would be nice maybe if they could get it even speeded up a little more, because I'm sure there's a lot of people are waiting for having various types of surgery.
They are well aware that they need to get up, they need to mobilize, they need to eat, they need to be walking around the unit, they need to meet all of these certain objectives before they can go home.
The ticket home really looks at what are your milestones to discharge, and when you hit these milestones, which are green on the ticket home, you can expect to have a discharge. And if you're still in some of the areas that are red or yellow, then you might expect to extend your stays.
On a adopté des outils destinés au système Lean Management dans toute la province. Les murs de visibilité donnent au personnel et aux dirigeants de la santé la possibilité de voir les résultats. Un système complet de mesures et de rapports favorise alors une meilleure transparence et un plus grand sens de responsabilité. Les ateliers sur les processus d'amélioration rapide, comme ceux auxquels nous avons assisté à Regina, réunissent les professionnels de la santé, le personnel, les chirurgiens, les membres de la direction et les patients pour étudier la chaîne de valeur, analyser en détail et améliorer chaque étape du parcours du patient.
People are more engaged, they're interested, it's very specific, we get to the point, we don't hang around a long period of time, so you can clearly see what we're trying to monitor, and if we aren't succeeding, you'll see a big red visible target that says we're not doing well, and when we've done well, it goes green, and we're seeing more green than we've seen in a long time. So for me, there's success in the fact that we actually have the rigor and the weekly focus.
What this RPIW, this improvement event, is focusing on is improving the setup process at the start of the day for the operating room here at the Regina General Hospital. This is part of a number of improvements that would be done to overall maximize the use and the value of that operating room time. And so getting that first case started on time, getting all the supplies, all the staff, all the equipment in place so that the case can start on time, and also looking at how the patient is introduced into their surgery on the day.
The learnings around the targets and the teams that are being created, those are the things that I find are most useful.
When people have the opportunity to be part of the change and part of the solution, that's where you move from top-down change that's likely to be resisted to people feeling like I own a part of this and I can take pride in the result.
We feel like we're being heard now, and our concerns are being heard, and things are actually getting done now.
The number of complaints about surgical wait times is down dramatically, and you're hearing from people who are saying, I got my surgery in a very short period of time, and that to me is what the greatest legacy of the surgical initiative will be.
I was a little bit surprised that it came along a little quicker than I'd expected. I think it's getting better. It's not perfect, but it's getting better.